Okay, so I think it's a good time to start now. The first thing that we'll be doing, so first the chairs will introduce themselves, and then we'll be going on to roll call. So I'm a current Limburg graduate, and I served in MUN for the past 4 years. And Anna, do you want to start?
I'm a sophomore, and I'm currently the director of training in Limburg MUN.
Okay, so now we'll be going into roll call. And if you hear your name, please say present or present and voting. If you have any questions about the difference between the two, please raise your hand and we can answer any questions. Does everyone understand the difference between present and voting? Okay.
Australia.
Someone said explain in chat.
Okay. So the difference between present and present voting is that for all voting in formal caucus, if you're present and voting, you need to vote on these issues. You cannot abstain. And if you're just present, you can still vote, but you're not forced to vote in those formal caucuses.
Okay. Australia.
If you could please unmute and say present or present and voting, that would be great.
Austria.
Present.
Bolivia. Brazil.
Excuse me?
Yeah.
I would just say present for Bolivia.
Okay.
Okay.
Brazil.
Present.
Burundi. Canada.
Present.
Chile. China. Colombia.
Present in voting.
Costa Rica.
Present.
Djibouti. Egypt. Ethiopia.
Wait, sorry, for Egypt, she's logging on right now.
Ethiopia, present and voting.
Okay. France.
So make sure when you hear your name, you say present or present and voting.
Sorry, present.
Germany.
Present.
India.
Present and voting.
Ireland. Israel.
Present.
Japan. Nigeria.
Present.
North Korea.
Present.
Portugal.
Portugal is having internet problems. He's supposed to be on, but yeah, so I was told to say he's coming on.
Okay.
So after roll call, we can just go with the people that came late and then ask them again.
Russia. Slovenia.
Present and voting.
South Africa.
Present.
Spain.
Present and voting.
UK.
Present in voting.
USA.
Present and voting.
Okay, we're going to go over the people who didn't say anything. Australia. Burundi, China, Djibouti,
Oh, one second, Anna. Is Chile here?
Yeah, present and voting.
2.08
Present and
miles,
voting.
3.34 kilometers.
Djibouti, Egypt, Ireland, Japan.
Oh, Egypt is here.
Okay. So you can either say present or present in. Oh, can you please change your name to Egypt?
Oh, yeah.
And can you state if you are present or present in voting?
Present voting.
Okay. Ireland, Japan, Portugal, Russia, and that's it.
Okay, so after this, I'll be taking any points or motions. Does anyone not understand parliamentary procedure or needs me to explain anything? And if you have any questions, you can just put them in the chat or unmute yourself and ask. This can also be about how the virtual mock conference will be running, since it's a little different than a in-person conference. So
Point of inquiry, is technology allowed, like having online resources and stuff?
yeah, it's allowed.
Okay.
Okay, so parliamentary procedure is essentially when each caucus is made with a motion. And so points are usually for questions, as Slovenia asked with a point of inquiry. But we have moderated caucuses and unmoderated caucuses. During the moderated caucuses, we form these with a motion. So you can say motion for a moderated caucus or an unmoderated caucus. And you also specify the time length and the amount of time, the amount of speakers or the time that each speaker has. And afterwards, so after that's exhausted, you can keep motioning. So essentially everything in this conference is guided by you, the delegates in the committee, and the chair usually agrees upon whatever the most popular motion is. So if this is your first MUN conference, I would say it's pretty easy to understand, like after the first moderated caucus. So are there any questions specific to like how this particular online mock conference will be run?
So for this conference, raising your hand on Zoom will be equivalent to raising your placard in a committee. So to raise your hand, you click participants on the bottom, and then in the participant screen, you can see a place that says raise hand and then lower hand. So that's going to be equivalent to raising your placard. We're going to be hosting unmods via Discord. So if you can see the Discord link in the chat, you guys should join it and name your country name. And you can ask any of the chairs if you don't know how to do that. So basically you can see in the Discord, there's a lot of text channels and a lot of voice channels. So you can join a voice channel and join blocks via specific voice channels. So if there are any other questions on how we're going to be hosting the virtual mock, you guys could ask them now.
One more thing is that we can see who raises their hand first. So we'll also be using that to choose who is speaking, as well as how many times you've spoken before, to make it fair for all the delegates. Are there any more questions? Okay, so So I can't do this. I think only Ian can, but essentially when we're going to vote on things, you're going to receive a poll, and this will be like a multiple choice on which resolution that you're so there's going to be a resolution presented, and you're probably going to get like a vote for, a vote against, or an abstain, and you're going to have to choose one. The poll will probably last about a minute, and every one of you will receive that. So that's going to be how you're voting. And reminder, if you're present and voting, you must not abstain in these polls. Okay, yeah. If you're having technical difficulties, message Ian. So if there's no more questions, I guess we can go ahead and get started. So are there any more, are there any points or motions on the floor? USA?
Motion to open debate.
That is in order. So we'll now vote. So for these normal motions, you'll just raise your hand for voting. So all those for? All those against?
Reminder that raising your hand means raising your hand in Zoom chat.
Yeah, you're not raising your hand in person.
Yeah, raise your hand in the Zoom chat. If you don't know how to do that, click participants and then go to the bottom and then click raise hand.
If you're not able to, just please message us right now because this is very important. Okay, so this motion passes. Are there any other points or motions on the floor? Israel?
Motion to open speakers list with 90 seconds speaking time.
That is in order. Are there any other points or motions? Bolivia?
Yes. I didn't raise my hand.
Okay, so when you raise your hand, could you also like lower your hand once you're done?
Yes, sorry about that.
Yeah. Slovenia?
Motion for to open speakers list for 1 minute speaking time.
That is in order. We will now vote on the two motions on the floor. So can everyone lower their hand? And we want this to go as quickly as possible. So make sure that you have the participants tab open so you can vote, you can raise your hand quickly. So not be voting on the most disruptive, which is opening speakers list with a 90-second speaking time. All those in favor? Okay. Can everyone lower their hand? All those opposed? Okay. So this motion, passes, and we will now open the speakers list. Israel, would you like to speak first?
Yes, please.
Okay. Okay, I will be opening the timer. So you see.
I think we'll get the entire list right now, or at least a good number.
Okay.
So all those wishing to be on the speakers list, please just keep your hand up. I will list off names after Maya starts sharing the screen.
Okay, so I'll be sharing the speakers list, let's see.
Sorry for the delay, guys. Just a reminder that the speakers list is a way for you to start giving your country's position to the committee. So it's a good opportunity to speak. So please raise your hand if you want to speak. So India, Israel, okay, sorry.
Please raise your hand if you want to be part of the speakers list.
Spain, Slovenia, Colombia, USA, Ethiopia, Canada, Nigeria.
So I'm gonna cap it off of for 5 speakers list for now, and if we ever go back to speakers list, then these will be the next speakers.
Can I ask everyone to lower their hands? Or if you've already been called on, make sure to lower your hands immediately.
Okay. Israel, do you see the timer on the screen?
No, I just see the document.
Okay. Do you not see the timer?
I see it now. Now I see it.
Okay. You have 90 seconds. You have the floor.
Esteemed Chair and fellow delegates, the delegation of Israel firmly believes that antimicrobial resistance will turn into an extreme crisis if no action is taken. The issue of AMR does not come from people, but from antibiotics itself. Instead of focusing all the attention on not letting people get infected, Israel urges the emphasis towards antibiotics and improving them to fight diseases. Through new subcommittees like the International Antibiotic Committee, who develop new types of antibiotics that are still able to fight the virus but are of a different makeup, making infection easy to fight, Israel believes this, along with new infrastructure, should end up simmering down this issue a bit. To further curb and directly manage drug-resistant infection spreading, the delegation of Israel urges the creation of contact tracing in terms of drug-resistant infections and new testing kits. The creation of these will be strictly monitored by a subsidiary body underneath the United Nations and will be kept to the best conditions possible. Through these policies, this delegation hopes to tackle the issue at the core, which is antimicrobial resistance, as well as ensure that new antibiotics can be created in order to fight drug-resistant infections. Thank you, and I yield the rest of my time to the chair.
Thank you, Israel. India, you have the floor.
Esteemed Chair and honorable delegates, as the country of India, I'm here today to discuss the issue of antibacterial resistance and how to combat it. This global issue is affecting India through poor sanitation and drugs that are overprescribed with little thought. This is due to underfunded faculties that do not have the capability to identify the precise bacteria that causes a disease. In rural areas, there is little provision of clean water and food, which increases the chances of waterborne and foodborne diseases. In 2017, the UN supported the government in achieving the goal of the National Health Policy, which was to attain the highest level of health and well-being for all, at all ages through a preventative and promotive healthcare orientation. UN agencies have also worked with the government to accelerate universal health coverage and affordable healthcare. India hopes to resolve or slow down antibacterial resistance through providing more support for rural areas to improve sanitary conditions and increasing funding for faculties that test for bacterial diseases. India yields the rest of its time to the chair.
Thank you, India. Spain, you have the floor.
Honorable Chair and fellow delegates, right now we're in the midst of a global pandemic, and because of this, it becomes even more evident how important people's health is, not only to national interests, but to the global economy as a whole. It is because of this that the resistance to antibiotics and the buildup of resistance has become even more important now. The delegation of Spain would like to show just how much it has been doing to combat this. Spain has created a national plan against resistance to antibiotics, which aims at educating everybody about the dangers of overuse of antibiotics because they are not valid for every disease and only go against biotic things and not viruses. I yield the rest of my time to the chair.
Thank you, Spain. Slovenia, you have the floor.
Honorable Chair and esteemed delegates, did you know that the elderly are also affected by antimicrobial resistance? The Republic of Slovenia would like to protect the people, especially the elderly, in third world countries where it is more common. My call to action is, my plan is as easy as pie. Protect, infrastructure, and educate people about antimicrobial resistance by first protecting the people ahead of time, especially the elderly, with frequent checkups to prevent AMR and creating awareness to protect people from viruses and bacteria. We would also like to take a direct approach by building hospitals to treat people with antimicrobial resistance. And finally, we would like to educate people by creating a hand-washing campaign for schools and businesses alike to prevent them from getting AMR. Please send a note or text if you have any questions. I yield the rest of my time to the chair.
Thank you, Slovenia. Colombia, you have the floor.
The delegation of Colombia firmly believes that antimicrobial resistance will become a major issue if left unchecked. The delegation of Colombia has taken many actions, including having set up the COIPAR system to monitor and survey antimicrobial resistance in farms and slaughterhouses. The delegation of Colombia proposes the RRC plan, restraining new resistant strains, restricting the growth of current resistant strains, and controlling antibiotic usage to ensure that the issue of antimicrobial resistance will disappear in the future. By implementing this plan, we can work towards eliminating antimicrobial resistance together. If you have any questions, please send me a note. I yield the rest of my time to the chair.
Thank you, Colombia. With that, we'll now be taking any more points or motions. Please raise your hand in the chat if you would like. Canada?
Motion to open an 8-minute moderated caucus with 1 minute speaking time on solutions.
1 minute speaking time?
Unmoderated.
Moderated, right? Germany?
Motion to have a 7-minute moderated caucus, 1 minute speaking time on current solutions that country is enacting.
Slovenia?
5-minute unmod for and 30-second speaking time for plans for the elderly.
That's fair. Okay, so we have 3 motions. We will now be voting on motions from most disruptive to least disruptive. First is the unmoderated caucus. All those in favor for a 5-minute unmoderated caucus discussing plans for the elderly. Please raise your hand in the chat.
Moderated caucus.
Moderated caucus?
Yeah.
How much speaking time?
30 minutes. 30 seconds speaking time.
Okay. So we'll not be voting on Canada's 8-minute motion, 8-minute moderated caucus, 1 minute speaking time for general solutions. All those in favor, please raise your hand. That passes. So we will now be in an 8-minute moderated caucus with 1 minute speaking time for solutions. Canada, would you like to speak first or last?
Last, please.
Okay. Please please lower your hand. Can everyone lower their hand before? Okay. Please raise your hand if you would like to speak in this moderated caucus. Anna, okay.
Israel. Oh wait, not Israel. Sorry, my bad. Chile. Austria. Dprk. USA. France. Germany. Bolivia. Ethiopia.
The last speaker is Canada, so we will be having 8 speakers since it's a 1 minute speaking time.
Wait, we need 1 more.
Isn't this 8 speakers? Canada said they would like to speak last.
Okay, sorry, my bad.
Okay, so we will now be starting with Chile. You can start whenever you're ready. You have the floor.
The delegation of Chile firmly believes in utilizing preventative measures instead of creating new drugs. These new drugs would only be subject to the same problems that create antimicrobial resistance in the first place, which is the overuse of these prescriptions, and any new drug created would just be completely rendered useless because of antimicrobial resistance. So the delegation of Chile believes that we should try to target the population and bring them the awareness of the dangers of antimicrobial resistance, so that less people continue to overuse their prescriptions, and we can stop the existing problem at its root. And it is a long-term solution instead of utilizing new drugs, which only create a short-term solution that will save a few lives, but then it's just going to be then that solution is going to be gone forever because of antimicrobial resistance.
Thank you, Chile. Austria, you have the floor.
Okay. The delegation of Austria knows exactly what this problem is, and we know how to combat it in a first world country. Some solutions that we have implemented includes surveillance on every antibiotic that is used, whether it be on human or agriculture. However, we realize this might not be viable in many countries that just can't afford to put such a system in place. Manufacturing new antibiotics is also expensive and costly, and we might not be able to make them. So Austria has made up a plan to combat bacteria with living organisms, or a bacteriophage. So bacteriophages are viruses, but they specialize. They only kill a certain kind of bacteria. If you were to find the right kind of bacteriophage and enter it into a person, it would only kill the bad kind of bacteria. So they're literally like specialized missiles, unlike antibiotics, which kill both good and bad bacteria.
Okay, thank you, Austria. DPRK, you have the floor.
As our supreme leader, son of the communist future, first said, our cause is just, and the might of Korea that is united with truth is infinite. The mighty People's Democratic Republic of Korea will fight against these measly microbes that disrespect our shining star of Paektu Mountain by targeting his loyal followers and trust that through his blessing, our citizens will prevail. The DPRK puts great emphasis on the development of new medication through private and public investment on existing companies, as well as establishing infrastructure in developed areas. For our leader, our great leader, is innovative and his wisdom shall not be questioned. The People's Democratic Republic of Korea looks forward to discussion with any nation that respects the intentions of our beloved and respected leader. I yield my time.
Thank you, DPRK. USA, you have the floor.
Honorable Chair and esteemed delegates, the delegation of the United States of America sees antimicrobial resistance as a global issue, and as a result, we seek a collaboration between the public and private sectors with a three-pronged proposal. In addition to the work being done by governments across the world, we urge healthcare-related organizations to first, work towards developing new antibiotic systems, and second, improving access to adequate sanitation and hygiene in the rural healthcare facilities of developing nations, which reduces the need for antibiotics and thus alleviates the need for alleviates antimicrobial resistance. Third, we encourage major food corporations to utilize their brand names and limit the unnecessary use of antibiotics in agriculture. Because antimicrobial resistance is a global health issue that must be resolved, we urge our fellow delegates to join us in taking action together. Thank you, and I yield the remainder of my time to the chair.
Thank you, USA. France, you now have the floor.
Esteemed Chair and delegates, the delegation of France believes that we should raise awareness about the inappropriate use of antibiotic resistance through funding extensive global and country-specific data collection, not only in farms, but more importantly, in hospitals, that would help identify the flaws in our system and educate doctors and the public about the adverse effects of antibiotic usage. Additionally, any option that might help us move away from the need to use antibiotics should be used and promoted, such as vaccinating more people, especially in flu season, and setting a high standard of hygiene in hospitals. I yield the rest of my time.
Thank you, France. Germany, you have the floor.
The delegation of Germany believes that Germany's acts towards fighting this global pandemic or this global issue are seeming to educate others in the population that antibiotics are not meant for every disease to be treated. Also, Germany's DART plan in English will help educate and spread will give more money to the further expansion and research towards these antibiotics and to help spread, while creating new ones and macrophages to help prevent overuse of these bacteria. While it is important to realize that even using macrophages can lead to the cost and many companies will not be able to profit from it, it's important to continue the research and help fund these research things. Sorry.
Thank you, Germany. Olivia, you now have the floor.
Honorable Chair and esteemed delegates, Bolivia would like to say that the matter of AMR is of utmost importance. In order to fight against this global threat, Bolivia feels that AMR can be fought using a scientific study. Evidence rooted in science is the surest way to build a plan that will help the global problem be solved as soon as possible, as well as in the most cost-efficient manner. If we conduct risk management based on scientific evidence, it will also be favorable for political and legal environments to flourish, allowing a health response that will have favorable impacts as well. Additionally, educating people about the dangers of AMR and how to mitigate this as well is important as well. Thus, Bolivia would like to say that we should work on funding scientific endeavors regarding AMR, as well as scientific campaigns which educate about the importance of washing hands and finishing prescription to ensure that bacteria don't mutate.
Thank you, Bolivia. And finally, Canada, you have the floor.
Canada would like to commend the previous speakers. Currently in Canada, we have a 4-part solution to our antimicrobial resistance problem. The 4 parts being 1, surveillance, 2, infection prevention and control, 3, antibiotic stewardship, and 4, research innovations. Of these 4 parts, we believe that for the surveillance part, we can offer our model of surveillance, which consists of multiple programs to gather national data, create evidence-based policies to support responsible antimicrobial reuse in hospital, community, and agricultural settings, and identify potential measures that could minimize the emergence and spread of resistant bacteria among animals, food, and people. We can offer these models to other countries who would like to have our expert group. And of the second part, infection prevention and control, we would like to offer guidance for healthcare providers in countries such as India to help them decide on the most appropriate drug, the most correct dose, and the most correct duration. And for
Thank you, Canada. So time is up. Are there any other points or motions on the floor? Please raise your hand.
Colombia.
A motion for an 8-minute unmod, 8-minute mod with 1 minute speaking time on this topic of antibiotic usage.
Antibiotic what?
Usage. Antibiotic
Usage.
usage.
Okay. Any others?
UK.
Motion for 9-minute moderated caucus, 1.5 minute speaking time on the different causes of antibiotic resistance and how to address them.
Austria. Oh, sorry.
Motion for an 8-minute unmoderated.
Wait, can you hold on for a second?
Could you repeat that?
The different causes of antibiotic resistance, as well as how to address them.
Okay. Anna, you can go on.
I can
Austria.
go now. Yeah. Okay. Motion for an 8-minute unmoderated caucus.
Topic?
What?
Is just for general solutions?
Yeah.
Okay. So those are in order. We will now be voting from most disruptive to least disruptive. All those in favor for Austria's 8-minute unmoderated caucus on general solutions? Okay. That motion passes. We will now be entering an 8-minute unmoderated caucus. Does everyone know how to use the Discord?
So basically, if you go on the Discord, you can see that there's a bunch of text channels and voice channels all labeled with a number. So you can use these rooms if you want to form a block or form alliances with other delegates. When you are on Discord, make sure that you're muted on Zoom, and then you can text or chat with each other, but make sure that you're not interrupting each other and you're staying polite.
Just to reiterate, please stay muted on Zoom.
So that concludes our unmod. Can everyone leave the Discord and join back into the Zoom call? Yeah, and in the future, I'll put the timer in the Zoom call so you can just reference how much time you have left. Okay. Second. So I'm gonna go and take more points or motions.
So one reminder, during unmods, for example, if you're texting in text channel 1, then we recommend you join voice channel 1 and you can mute yourself on it, but just make sure that you're joining the same voice room that you're texting in, and you can mute yourself and text instead, but make sure that you're joining like the dual rooms.
Until the chair calls for points or motions, can you everyone please put their hand down?
Okay. Are there any points or motions? Anna, you can start calling.
Can you share your screen?
Yeah, I'm sharing right now.
Okay. Egypt. Egypt, your point or motion?
Egypt, you have to unmute yourself.
Oh, can you go again? I unmuted you.
Okay. Motion for a 5-minute moderated caucus with 1 minute speaking time on summary of Unmod.
Are there any other points or motions?
USA.
Motion for a 6-minute moderated caucus with 30-second speeches to discuss what happened during the
Okay, any others?
Nigeria.
Motion for speakers list.
So speakers list actually happens when all the other motions that have been proposed fail. So if there's any caucuses that you would like to motion for. Nigeria. Do you have another motion?
Oh, a motion for 3-minute moderated with 1 minute speaking time.
I'm gonna have to rule out dilatory because that is too short. Would you like to amend that to a longer speaking time or a longer moderated caucus?
No.
No? Okay, so we only have 2 moderated caucuses. We will now vote. So now from most disruptive to least disruptive, we'll start voting on USA's 6-minute moderated caucus with 30 seconds speaking time. All those in favor? Please raise your hand if you're in favor.
All those against.
So this fails. We'll now be voting on Egypt's 5-minute moderated caucus, 1 minute speaking time on the summary of Unmod. All those in favor? Okay, I'm gonna do this again. Can everyone lower their hand? All those in favor of Egypt's 5-minute moderated caucus, 1 minute speaking time on the summary of Unmod, please raise your hand. All right, this passes. Egypt, would you like to speak first or last?
First.
Okay. We will now be calling on other speakers.
UK.
Okay.
Brazil. Bolivia.
Yeah, but we voted on USA's and that failed.
Olivia.
I'm sorry, I meant to lower my hand.
Oh, okay. India. Chile. Chile.
Okay. So we'll now be starting with Egypt.
Esteemed delegates and honorable chair, the delegation of Egypt agrees with Colombia and Slovenia that the government needs to have more laws on selling prescription drugs. Pharmacists are selling antibiotics to people that don't have prescriptions, which causes more resistance. We need measures passed to stop pharmacists from doing this because overuse of antibiotics when it's not needed promotes antimicrobial resistance. Thank you. I yield my time to the chair.
Thank you, Egypt.
Reminder that during unmods, you do not yield your time to the chair, you simply stop speaking.
UK, you have the floor.
Okay,
UK.
esteemed chair and fellow delegates, the delegation of the UK, The United Kingdom worked with countries such as Ethiopia, South Africa, and Bolivia during the Unmoderated Caucus in Channel 8 to discuss ways to educate the public and about appropriate antibiotic usage, as well as prioritizing training healthcare workers, funding underdeveloped countries, funding research on antibiotics, as well as education for medical staff and helping improve the quality of life at the hospitals. I yield my time to the chair.
Thank you, UK. Brazil, you have the floor.
Esteemed delegates and honorable chairs, the delegation of Brazil agrees with Bolivia and believes that educating doctors, pharmaceutical companies, and the public is the best way to prevent antimicrobial resistance. Doctors should have better diagnostic tools in order to prescribe only the most necessary antibiotics, and pharmaceutical companies should be restricted from pushing their own drugs. The public should be warned of the consequences of antimicrobial resistance in order to prevent them from seeking out unaccredited antibiotics. I yield the rest of my time to the chair.
Thank
This
you,
is just a
Brazil.
reminder that during moderated caucuses, you don't have to yield your time. That's only in speakers list.
India, you have the floor.
In the Unmod, it was discussed that it was most important for awareness to be spread and people to be educated on this issue. It would be beneficial to survey potential threats beforehand. And also it was discussed that we need to be working towards specific research and alternatives to antibiotics. There also needs to be better tools to help developing countries, enabling doctors to prescribe accurate antibiotics to patients.
Thank you, India.
The delegation of Chile spoke with countries like Colombia and Slovenia in the Unmod, and we discussed preventative actions, such as requiring prescriptions to purchase antimicrobials, and we also talked about educating the public and making the public aware of the dangers of AMR. Some ideas that our block spoke of was through sending speakers to large online platforms and to developing areas, especially schools, to teach all these people about the dangers of AMR. And we also spoke about creating hand washing campaigns. Our block is strictly against making the majority of funding towards creating new antibiotics because it may take 10 to 15 years to make a new drug, and bacteriophage treatment is simply not a good alternative because it costs $8,000 to $20,000 for one bacteriophage treatment.
Thank you, Chile. We'll now be entertaining other points or motions. Please raise your hand if you have a point or motion. Germany. Germany, what's your motion?
Motion for 8-minute moderated caucus, 1 minute speaking time on the importance of funding.
Thank you, Germany.
Colombia.
8-minute moderated caucus with 1 minute speaking time on the subject of restricting antibiotic usage.
Thank you, Colombia. Any others?
No one else is raising their hand.
Okay. We'll now entertain these two motions. Since they're equally disruptive, we'll start with Germany's motion. All those in favor of an 8-minute moderated caucus with 1 minute speaking time on the importance of funding, please raise your hand.
South Africa. Oh wait, sorry, never mind.
Please lower your hand. All those opposed? This motion passes. We will now be entering an 8-minute moderated caucus with 1 minute speaking time on the importance of funding. Germany, would you like to go first or last?
First, please.
Ethiopia. Canada. USA. Israel. South Africa. Slovenia. Colombia.
Is that 8? Yeah, that's 8.
Just a reminder that when I call on you, you can lower your hand.
Okay, Germany, you have the floor.
Honorary delegate, esteemed chairs. The delegation would like to stress the importance of funding through all countries. Funding can help education become more widespread. Germany would also like to commend the UK's past solution for medical subscriptions to prevent startups from filing for bankruptcy. They help new actions and possibilities. With funding, medical subscriptions and startups can help develop new possibilities such as phages and preventing bacteria from spreading between people. Germany would like to yield.
A reminder that you don't have to yield for moderated caucuses. Also, Germany, on my end, I'm not really sure if it's on anyone else's end. It's a little bit scratchy. So, yeah. Okay. Ethiopia, you have the floor.
Okay. As an underdeveloped country, our nation needs a lot of funding just to get by. We have underdeveloped environments, and we get secondhand medication, and a lot of our healthcare workers don't actually know what they're doing sometimes. We really need funding just for education and getting to an environment that actually works. We talked with Spain, Germany, and the UK in our UNMOD a lot about how we could get this funding too. But countries like South Africa, Nigeria, and also the nation of Ethiopia, we are really struggling just to get to that baseline of having a proper and working environment for our citizens.
Thank you, Ethiopia. Canada, you have the floor.
Delegation of Canada would like to commend the previous speakers. As a developed country, Canada is willing to offer funding for the least developed countries that are in critical need, and we would call on all other developed countries to do the same. Specifically, we would like to see our fundings going towards the infection prevention and control objective of our plan, specifically to healthcare providers and people, to educating them in the rural areas. However, we would like to see that our funding is transparent so that it can prevent things just such as corruption. Thank you.
Thank you, Canada. USA, you have the floor.
The delegation of the United States of America would like to commend the previous speakers, especially Ethiopia and Canada, for mentioning the use of funding for developed nations. So previously we discussed with Ethiopia, the UK, Spain, and South Africa, discussing education in developing First, education can work in tandem with improving sanitation in these developing countries, which is specifically what the US proposes. Second, these developed nations and corporations like Canada stated can use their funds to spread awareness in developing nations. And if anyone, any other delegates also want to promote education in developing countries, please message the US, because our opinions are essentially the same in providing funding for developing nations. Thank you.
Thank you, USA. Israel, you have the floor. Israel, you have the floor.
Yeah. So if we're talking about funding here, I feel like funding is really important in terms of resolutions. And I would like to commend the previous speakers for talking about this. And what I would like to say is that funding can be used for like bigger labs, bigger healthcare facilities, and it can also be used for creating new test kits and contact tracing. So this is essentially extremely important infrastructure that is needed in order to solve this problem, and this funding can be used for that. Thank you.
Thank you, Israel. South Africa, you have the floor.
As an underdeveloped country right now, and as we're transitioning to a more modern time and having more doctors and offices available to people, we need more funding. Most people who are currently living in tribals or community states need more funding to be able to get more doctors and be able to actually help with sanitation and other more basic necessities. Others, as USA has stated, like funding is very vital for us developing countries. Thank you.
Thank you. Slovenia, you have the floor.
As a second world country, Slovenia is very hit by by antimicrobial resistance, and we need funding for things like our hand washing campaign. So in the past, we have done things with the WHO for preventing antimicrobial resistance in elderly people, and we have sponsors from the WHO. So I think the WHO and some of the other sponsors that we already had might be able to help with our hand washing campaign and other things.
Thank you, Slovenia. Colombia, you have the floor.
So, like any good plan on combating antimicrobial resistance and just any global issue in general, funding is extremely important for solving this issue. We would like to raise funding by requesting funds from WHO in solving this issue and being able to implement plans such as restricting antibiotic usage and surveying the globe for any potential new resistant threats. I yield the rest of my time to the chair.
Thank you, Colombia. We will now be entertaining other points or motions. Please raise your hand. Nigeria.
Motion for a 6-minute mod with 30 seconds speaking time on common diseases and AMRs. On 30 seconds.
30 seconds. Any other points or motions?
Israel?
Motion for a 8-minute moderated caucus, 1-minute speaking time on the topic of creating new antibiotics and quality assurance of current antibiotics.
Any others?
Austria?
Motion for an 8-minute moderated caucus, 1-minute speaking time on current solutions for combating bacteria that is already resistant.
Thank you. And we'll now vote on the resolutions from most to least disruptive, starting with Israel's 8-minute moderated caucus, 1-minute speaking time on creating new antibiotics and the quality assurance of current antibiotics. Please raise your hand if you are voting for this resolution, for this motion. Please lower your hand. All those opposed? Okay, this motion passes. Israel, would you like to speak first or last?
Last, please. Thank you.
Okay, so we'll now, can everyone lower their hands? Okay, so we'll now be calling on speakers. Everyone who wants to speak, please raise your hand.
Dprk. South Africa. Austria. Just a reminder to lower your hands once I call on you. Chile. UK. Canada. USA.
I think the last is Israel, correct?
Mm-hmm.
Dprk, you have the floor.
The Dprk acknowledges that antibiotics are overused. While our citizens, under the guidance of our wise Supreme Leader, do not commit these measly mistakes, we understand that many others do. Therefore, we believe that it is important that people are educated to prevent the spread. However, no matter how much we try to prevent AMR, it will still happen. So we must also work towards developing new solutions. Many innovative solutions have been proposed, like by countries such as Australia, who mentioned bacteriophages, as well as simply funding research for new antibiotics. As our great leader first said, the only thing we have to fear is fear itself. So we should not fear our future, but rather fight it head on together.
Thank you, Dprk. South Africa, you have the floor.
The delegation of South Africa believes that we do not need to start creating new antibiotics, because with the as Chile already said, creating new antibiotics is equivalent. It's completely useless because they'll be rendered as AMR later on in the future. So we believe that funding should go to current doctors and health companies to make sure that everybody has the chance to get proper care for what they have. And also, not only should doctors get educated about current situations, people should also be educated, because they usually come from tribal or community states. These people are usually still connected to their old ways of how they treat medicine and heal different people. Thank you.
Thank you. Austria, you now have the floor.
Okay, the delegation of Austria believes very strongly on creating new antibiotics. So we believe that we can combat this problem using a mix of solutions, including creating new antibiotics, educating people about the dangers of overusing antibiotics, and the idea I suggested before, phages. So creating new antibiotics could be very viable if we had enough funding for it. So I suggest we could ask different countries for funding, and then we put vigorous testing on antibiotics, because we already know antibiotics work. And then with these new antibiotics, I suggest that we don't give it out for commercial use, whether it be on agriculture, and we only allow it in a doctor's office. And in our solution, we would only let doctors use it when it's absolutely necessary. So this way, we stop the creation of resistance to new antibiotics too. Thank you.
Thank you. Chile, you now have the floor.
The delegation of Chile strictly believes that creating new antibiotics is not the solution. As stated before, it will take at least 10 years to create a new antibiotic. And by that time, in 2030, it is estimated that 24 million people would be forced into poverty by AMRs already. So this solution is just too slow. That is why the delegation of Chile is proposing preventative measures instead, such as educating the public to make them aware of the dangers of AMR so they stop overusing antimicrobials. And the delegation of Chile also believes that tracking the spread of AMR is very important. And the delegation of Chile believes that this can be done through the creation of a subcommittee that will collect information from all countries around the world to track the spread of antimicrobial resistance and track it all the way to its source, and then hopefully solve that source.
Thank you. UK, you now have the floor.
Esteemed Chair and fellow delegates, the UK believes that a major part of antibiotic resistance is the lack of better antibiotics. Innovation of new antibiotics are currently extremely slow. Many companies aren't creating new antibiotics unless it's completely necessary. This is because pharmaceutical companies are currently hesitant to create new antibiotics due to a lack of incentive in the market. The UK suggests that a budget be created to support this innovation, and the budget will be used to boost production of new antibiotics from pharmaceutical companies. The UK also believes that we should set up an upfront payment scheme where companies are rewarded for creating antibiotics in order to make it profitable and lucrative. This will allow pharmaceutical companies to create newer, more efficient antibiotics to prevent overdose, as well as stop antibiotic resistance. I yield my time.
Thank you, UK. Canada, you now have the floor.
Canada would like to commend the previous speaker. The delegation of Canada realizes that currently, because only the more developed countries have the facility and funding sufficient to sustain research, while the less developed countries are struggling with budget, such as preventative measures, that they do not have enough budget for research. Therefore, we think that it's necessary for developed countries to share their research results. However, this creates the problem that since patents and
Canada,
wait, sorry, was I on mute?
No. You're fine. I think the speech got cut off because of Wi-Fi problems, but I was able to hear most of it.
Oh.
Okay, thank you, Canada. USA, you now have the floor.
The delegation of the United States of America believes that new antibiotics should only be used as a temporary solution to the diseases that are already resistant. In the meanwhile, other delegations should join the US in their initiative with other nations such as Spain, India, and the UK to research solutions and provide sanitation and education to developing nations. So if any of your nations also talk about funding for developing nations and also providing education, either alleviating unnecessary antibiotics, or even simply just involving major corporations or the private sector, please message the United States of America, and we'll add you to a document that includes nations such as Spain, the UK, and India. Thank you.
Thank you, USA. And last, we have Israel. You have the floor.
The delegation of Israel highly encourages research and production of new biotics, as well as pushes for quality assurance of current antibiotics. So with my proposed infrastructure in place, there will be new large laboratories. And in these large laboratories, more research and development of new antibiotics can start. And the funding can be provided by WHO budget funding, as well as IMF loans and programs, as well as some countries giving money, as Austria explained. And also, Israel has created a subcommittee within WHO called the IABC, or the International Antibiotic Committee, which will be the R&D of getting new antibiotics to deal with AMR. And for quality assurance, we will also create another subcommittee within WHO called IQAC, or International Quality Assurance Committee, which will monitor and ensure that the quality of antibiotics is proper. And there are a whole bunch of guidelines. So if you would like
Thank
to.
you, Israel.
Okay, thank you.
So right now, the chair would smile upon an unmoderated caucus. So are there any points or motions on the table?
Israel? Motion for a 10-minute unmod, just on general solutions. And like forming blocks.
Just a reminder that an unmod doesn't need a topic. Nigeria?
Motion for an 8-minute or 1-minute speaking time on impact of AMRs.
Slovenia?
Slovenia?
20-minute unmod.
I'm going to rule out dilatory. That is too long.
15-minute unmod.
Okay. Okay, so we'll now be voting on the 3 motions that we have. Can everyone put their hands down? Okay, I want to lower all the hands. Slovenia, can you lower your hand?
Okay, we're good.
Okay. So now voting for Slovenia's 15-minute unmod. Please raise your hand.
Okay, I'm gonna lower all hands. I'm gonna lower all hands now.
Okay.
And all those against? So this motion does not pass.
We'll now be voting on Israel's 10-minute unmod. All those in favor? This clearly passes. So we're now going to be in a 10-minute unmoderated caucus. You can join the Discord.
Okay, everyone, this unmod is ending now. Guys, this unmod is ending right now. So mute yourself on Discord. So now I'll be taking any points or motions on the floor. Israel?
Motion for an 8-minute mod with 1 minute speaking times on the topic of what was discussed in the unmod.
Austria?
Yeah. Would Israel like to amend that to 10 minutes instead of 8?
Yeah.
Okay.
Colombia?
An 8-minute mod with 1 minute speaking time on the subject of surveying the world for potential resistant threats.
And we'll take one more, UK.
Wait, I don't.
Motion for a 9-minute moderated caucus with 1.5 minute speaking time on ways to reduce antibiotic usage.
Okay, so now we will be voting on Israel's 10 minute mod on 1 minute speaking time of the topic of the unmod. Please raise your hand. Okay, I'm gonna lower all hands now. And raise your hand if you're against. Okay, so this motion passes. Israel, would you like to speak first or last?
I'd like to speak last, please. Thank you.
So please raise your hand if you want to be added to Austria, Colombia, Dprk, USA, France.
Point of information, what is the current topic for this moderated caucus?
The unmod.
Oh.
Would anyone else like to speak? Okay, so Israel will go last. Austria, whenever you're ready.
Okay, during the previous unmoderated caucus, the delegation of Austria had the privilege of talking to many countries, including Israel and Colombia. So we discussed a lot of solutions, and in the end, we figured out a 3-solution plan to end the problem of AMRs. Yeah. So the first plan is creating new antibiotics. So we know this one would take a long time, and it would also take a lot of funding. But we think if we divert it on the side while we implement our other solutions, it would be a great opportunity. Then the next thing is using bacteriophages, which we already discussed in our previous the one unmod before that. And basically, if you use phages against bacteria, it causes the bacteria to make resistance to bacteriophages, which would then make antibiotics effective against these bacteria. And then the final thing is implementing a global surveillance system and education system using our subcommittee, the IQAC, which was suggested by Israel.
Austria, thank you. Next, we will have Colombia, whenever you're ready.
Just like how drug cartels are prevalent in Colombia, the issue of antimicrobial resistance is prevalent across the globe. During this unmoderated caucus, the delegation of Colombia discussed with Israel and Austria on the subject of antimicrobial resistance and how we can do something about it. So some of our potential solutions include, like Austria mentioned before, creating bacteriophages to combat any current resistant strains, creating surveillance systems across the globe to monitor any potential resistant threats, anchor down and restrict the usage of current antibiotics to prevent antimicrobial resistant spread, and creating new infrastructure so that we can combat antimicrobial resistance together. If you have any more information, please contact me through Discord direct message. Thank you.
Thank you, Columbia. DPRK.
The delegation of DPRK has discussed with countries like Austria and Israel on how to fund and tackle this solution. We discussed requesting a budget to be taken from WHO to establish a committee called IQAC, which targets both surveying regions as well as developing new solutions. The DPRK, along with these nations, presents a solution where prevention, infrastructure, and research work in tandem with each other to provide a solution that stands for the long term and helps the world see a brighter future.
Thank you. Next, we will have USA. USA.
The delegation of the USA had the privilege to work with nations such as Spain, the UK, Ethiopia, Russia, and South Africa to talk about developing antibiotics and other matters. First, we discussed the matter of reducing the amount of antibiotics used in agriculture, which slows antimicrobial resistance by as much as 40% in the UK. We also talked about integrating our individual networks, such as the CDC in the US and the UK's initiatives, together to fund research, sanitation, and education in developing nations. We also discussed the futile quality of simply developing new antibiotics, as it should only be used as a temporary solution, as in the meantime, we develop alternate solutions and also improve awareness of antimicrobial resistance in developing nations. If you'd like to join our initiative, please send your email to the Discord for the US to let us add you to the document to make a resolution.
France.
During the previous Unmoderated Caucus, I spoke to the UK and Russia, among other countries, about raising awareness by educating people. The UK has specific ideas about how we should travel and educate people, and France believes that we should conduct specific research. Additionally, we believe that finding alternatives should be implemented as a higher priority over creating new antibiotics, because creating new antibiotics are difficult and would put us in an endless cycle of resistance and new medications. Thank you.
Israel.
As the delegations of Austria, Colombia, and DPRK have already stated, Israel has created a subcommittee called the IQAC, which will essentially have global surveillance and will provide education to the global community about AMR and such. And our resolution also entails bacteriophages, new antibiotics, and quality assurance of current antibiotics. So the quality assurance of current antibiotics will be covered by the IQAC, while new antibiotics will be a temporary solution, as the USA stated. New antibiotics will be a temporary solution while the bacteriophages work its magic. I thank you.
Thank you, Delegate. We will now be taking more motions. Slovenia. Slovenia. Okay, Austria.
Sorry. So motion for 8-1 moderated caucus on defeating bacteria that's already resistant.
Slovenia, Colombia,
8-1 moderated caucus on restricting the usage of antibiotics.
Are there any more motions? Okay, since they're equally disruptive, we'll be voting on Austria's motion first, and 8-1 on defeating bacteria that's already resistant. Please raise your hand.
Israel, USA.
Oh, we're just voting on it.
Oh.
Okay, I'm going to lower all hands now. Please raise your hand if you're against. Okay, so this motion clearly does not pass. I'm going to lower all hands now. We're going to vote on Colombia's motion, 8 minutes, 1 minute speaking time on restricting the usage of antibiotics. Please raise your hand. Okay, I'm going to lower all hands now. Please raise your hand if you're against. Okay, so this motion clearly passes. Colombia, would you like to go first or last?
I would like to speak last.
Okay, please raise your hand if you would like to speak. UK, Austria, Dprk, Israel, Chile, Germany. We can take one more speaker. USA, and then Colombia. Okay. UK, whenever you're ready.
Esteemed Chair and fellow delegates, sorry. The delegation of the United Kingdom believes that there's 3 main causes and usage of antibiotics, all of which can be reduced. The first is usage in food animals, and this can be solved by creating regulations on excessive antibiotic usage on livestock for feeding efficiency and growth purposes. And the second is inappropriate usage of antibiotics. And this can be solved by funding non-governmental organizations such as the Keep Antibiotics Working Campaign to inform the public about the dangers. The UK also proposes that medical professionals, they should be required to inform patients about overdosing when prescribing antibiotics, as well as they should also be held accountable for any overprescription. Lastly, the UK suggests that a budget should be created to help support antibiotic innovation. And because by creating a scheme where companies are rewarded for creating new antibiotics, we encourage companies to create newer, more efficient antibiotics that make people less likely to overdose or overuse antibiotics. I yield my time, for sure.
This is just a reminder that during mod, you do not have to yield your time. Austria.
Can I start? Because I don't see the timer. Okay. 3, 2, 1, go. So there's many ways to stop the overuse of antibiotics, and one of them includes putting systems in place in every country. So using our committee that we want to start our subcommittee, the IQAC, we'll use funding from the World Health Organization and the IMF to place surveillance systems in different countries through their organizations. For example, if we want to put surveillance in the United States, we would go to the CDC and ask them for numbers. Then alongside the surveillance, we would also put in education systems with this. Because if you have the CDC targeting and counting the numbers of antibiotics, we could also end up putting education classes for adults and putting education classes in universities and possibly even high schools, and big advertisements that is telling you the dangers of misuse of antibiotics. Thank you.
Dprk.
The DPRK hears the concerns about developing new antibiotics, as it may be hard to understand the true effectiveness of this solution without a supreme leader who shines as great as ours. However, that is why we will establish methods of restricted distribution. That way we can save lives while also preventing bacteria from easily developing resistance.
Thank you, Delegate. Israel?
I would like to highly commend the previous speakers. They spoke about how restricted distribution is important, and the delegation of Israel extremely agrees with this, because doctors' offices should be the only people able to distribute it, doctor's office, hospitals, and healthcare facilities, and not pharmaceutical companies and others. So this is why the delegation of Israel believes that restricted distribution is important rather than like restricted usage completely. Thank you.
Chile?
The delegation of Chile agrees with other delegates that just spoke about creating a surveillance program and a subcommittee to surveillance the spread of antimicrobial resistance. Chile also believes that this subcommittee should also cover the testing of current antibiotics and how well they are at killing the bacteria, because if these antibiotics use the same ingredient as another antibiotic, but they fail to kill the bacteria, those bacteria are going to be resistant to that ingredient, and then that ingredient is just going to be completely useless. Furthermore, Chile believes that prescriptions must be required to purchase antibiotics, and Chile also believes that there should be a limit on how much doctors can prescribe to their patients, and Chile believes that doctors can only prescribe antibiotics to people if they're about to suffer some sort of damage from whatever disease they're suffering.
Germany?
The delegation of Germany would like to highly commend Israel and the previous speakers. In addition, the delegation of Germany has found 2 NGOs that would help spread education to those countries that need it. APUA, Alliance for Prudent Use of Antibiotics, would help spread and preserve the power of antibiotics. In addition, Compassion in World Farming, CIWF, would help educate those and try to emphasize and prevent the overuse of antibiotics in agriculture. Delegation of Germany believes that we need to educate countries to prevent the spread of antibiotic-resistant bacteria. Thank you.
USA?
The delegation of the United States of America would like to commend the previous speakers. We concur with the UK statement that there are mainly 2 reasons. First, usage in food, animals, or agriculture, which contributes to AMR, and second, unnecessary use of antibiotics in people. The agriculture aspect, or the food animals aspect, can be solved by utilizing major food corporations and their own brand names to reduce the use of antibiotics in these food animals like cattle. The people aspect can be solved in 2 ways. One is improving education and awareness in developing nations, and second is improving sanitation. And this is especially important because it reduces the presence of diseases and thus reduces the need of antibiotics. We already have an array of developed countries such as Spain, the UK, who are already ready to dedicate funds to developing nations who are also part of our initiative to fight AMR. So if you're interested, again, please message the USA to join our working paper. And thank you.
Colombia?
Okay. As many before me mentioned, the restriction of antibiotics is crucial to prevent known bacteria strains from becoming more resistant. Solutions such as making all antibiotics prescription would help to stop of misuse of antibiotics. Other solutions such as creating infrastructure, funding research, and educating the public and doctors about AMR are also great strategies to combat this massive issue. However, the delegation of Colombia believes that the most important step in combating AMR is to create a global surveillance network to detect new resistant threats as soon as possible. Utilizing a surveillance network would greatly help in timely identification of strains which could be resistant and would lead to early development of new vaccines and antibiotics. Together, By creating this network, we can detect these threats and finish the fight against AMR.
This is just a reminder to those whose cameras are not on. Please turn on your camera or at least show like a portion of your face so that we could see you guys. So now we'll be taking motions. So please raise your hand. Israel?
An 8-minute moderated caucus with 1 minute speaking times about a global surveillance committee.
Germany?
A 10-minute unmod.
Austria?
8-minute moderated caucus with 1 minute speaking time on education along with the surveillance system.
Okay, so we're voting for most disruptive. Germany with a 10-minute unmod, please raise your hand. I'm going to lower all hands now. Please raise your hand if you are against. This motion does not pass. Just a reminder that on procedural items, everyone must vote. Not even close to half of the people voted. So we're going to recount and everyone has to vote because it's a procedural item. All those for a 10-minute unmod, please raise your hand. Okay, I'm going to lower all hands now. Please raise your hand if you are against. Okay, this passes. I'm going to lower all hands and the 10-minute unmod will start now. Wait, I'd rather not screen share the timer because then I have to like, you can do it if you want. There's like 9 minutes left if you're going to screen share. Just do 9 minutes, 30 seconds. Okay, guys, so I see that you're forming blocks and stuff already, but right now I see 2 big blocks and they have a lot of people inside them. So I want to remind you that the goal of this committee is to have 3 resolutions. So I encourage those to split up into and form another block if you feel like your voice isn't being heard or there's too many people. And the requirements for resolutions are going to be 3 sponsors and 5 signatories. So we're going to cap it at 3. Yeah, it's a minimum. So a minimum of 5 signatories, and we're going to cap it at 3 sponsors. Okay, guys, the unmod is over, so please return to Zoom. So the unmod is over, so please return to Zoom and stop using Discord. So I'm gonna remind all of you guys that we are capping it at 3 sponsors and requiring a minimum of 5 signatories for your resolutions. Okay, so I'm gonna share my screen. Okay, so I see someone new joined. So if you've joined, please join the Discord server. Turn on your camera and then change your name to your country name. And please message Ian Chen privately if you're going to be present or present in voting. Okay, so now that the unmod is over, I'm going to be taking motions. Israel?
Motion for an 8-minute moderated caucus, 1 minute speaking time about bacteriophages.
Dprk? Dprk?
Sorry, I was on mute. Motion for 8-minute, 1 minute speaking time on what was discussed during the unmod.
Okay, so since these are equally disruptive, we're going to be voting on Israel's 8-minute, 1 minute speaking time on bacteriophages. Please raise your hand. Okay, I'm going to lower all hands now. Please raise your hand if you are against. Okay, so this clearly does not pass. Make sure, so this is just a reminder that on procedural items, everyone has to vote. So now we'll be voting on DPRK 8-minute, 1 minute speaking time of the topic of the unmod. Please raise your hand. Okay, I'm going to lower all hands. And now please raise your hand if you are against. Okay, so this clearly passes. DPRK, would you like to go first or last?
Last, please.
So please raise your hand if you would like to speak. Colombia, Austria, Israel, Bolivia, Chile, anyone else? Okay, DPRK. So 1 minute speaking time. Colombia, whenever you're ready.
Okay. So during the past unmoderated caucus, the delegation of Colombia discussed with countries such as Austria, Israel, Chile, and DPRK about potential solutions towards antimicrobial resistance. Some solutions mentioned that we came up with were implementing bacteriophages to combat current resistant strains, creating new infrastructure to combat this issue, restricting the use of current antibiotics to prevent known strains from becoming resistant, and implementing a global surveillance network to prevent future strains from becoming resistant. Noted Notably, we focused on setting up surveillance systems for underprivileged countries so that we can provide them funding so that we can create a system to monitor strains so that they do not become resistant.
Austria?
Yeah, okay. So during the previous Unmod, I spoke with the delegation of Israel and the delegation of Colombia about a 3-part plan. And I've already talked about bacteriophages and creating new antibiotics, but it's the third part that will pretty much make the deal. Basically, we are going to implement a surveillance and education system through all countries. So how it works is basically many countries already have their own surveillance systems. Like the United States, the CDC already has an antibiotic surveillance system in place. And all we do is, using our subcommittee, the IQAC, we take data from these countries and put it all in one big database to know which bacteria is resistant and where they're going to need new antibiotics or other solutions. Then we'll also put an education system using these organizations, such as big ads and health classes in universities, high schools, and for adults, to teach people about the dangers of antimicrobial resistance and overusing antibiotics. Thank you.
Now we'll be taking Israel whenever you're ready.
So during this Unmod, the delegation of Israel had the privilege of working with delegations such as the delegation of Austria, the delegation of Colombia, as well as the delegation of Dprk. And we talked about global surveillance systems. And as Austria said, a lot of countries already have a global surveillance system in place. So what our global surveillance system will do, the IQAC, it'll essentially be overarching on all the countries that do not have a system in place already. And we're also going to have education classes in universities, high schools, as Austria said. And in this, yeah, thank you.
Bolivia?
During the past Unmod, Bolivia had the chance to discuss with the delegations of Brazil, Colombia, Austria, and Slovenia. It looks like our plan is threefold. So education, like we will teach pharmaceutical companies, citizens, etc., and also have a hand washing campaign, as well as incorporate scientific study like microphages that Austria has talked about, as well as surveillance. The delegations are considering about how to implement a global system. So those are our 3 current ideas for a unifying plan. Thank you.
Chile?
During the Unmod, the delegation of Chile also had the privilege to speak with very great countries like the Dprk, Israel, Austria, and Colombia. And their plan is to educate the public, create antibiotics, and use bacteriophages as an alternative if bacteria become resistant to antibiotics. And while people may be skeptic of bacteriophages and they think that it's very experimental, this is because people have thought that antibiotics were just great, so they haven't really used bacteriophages. But now, as we've seen, countless bacteria are developing resistance to bacteria, so there's a great need for the use of bacteriophages. And bacteriophages happen to only target the bad bacteria, but antibiotics end up killing some very useful bacteria in our body along with the bad bacteria. And as we've seen before, it's creating resistance, which is rendering them completely useless.
Okay, so we're missing 2 speakers currently, so the chair would highly smile upon those who have not spoken yet or have only spoken once. We need 2 more speakers, so please raise your hand if you want to speak on this topic. The chair would highly smile upon those who have only spoken once. Slovenia. We need one more speaker. And the UK. Okay. Slovenia, whenever you're ready. Slovenia. Slovenia, you're muted.
Oh, sorry. The country of Slovenia highly frowns upon macrophages because it isn't a long-term. It's not a long-term solution for this problem, and long-term solutions are better for preventing AMR. Thank you.
Thank you, Delegate. UK, whenever you're ready.
The UK during the UNMOD, the UK had the honor of working with countries such as South Africa, USA, Germany, and many other countries to discuss many different topics such as emphasizing and recognizing the importance of funding education in underdeveloped nations, as well as doing our part to encourage like further actions, as well as educating medical professionals and spreading awareness of resistance.
Thank you, Delegate. Dprk.
The Dprk would like to commend the first 5 magnificent speakers and summarize that we have, along with countries like Israel, Austria, Colombia, and Britain, solidified our solutions to address surveillance, education, and research. We concluded that the surveillance would be targeted towards underdeveloped nations to be most cost-effective, since we do acknowledge that many established countries already have their own methods of surveillance. The research was already addressed by previous speakers, but we want to emphasize again that these antibiotics will be distributed under supervision. With the most effective systems put into place, we believe that our solution will lead to a future that shines almost as brightly as our great leader and guiding sun rays. Please reach out if you have any questions.
Thank you, Delegate. We will now be taking any motion. So lunch will start at 12:30. So we have time for 2 more moderated caucuses. We would frown upon any more unmods before lunch. Austria.
Motion for an 8-minute moderated caucus, 1 minute speaking time on combating bacteria that is already resistant to all of our current methods.
Olivia.
8-minute, 1 minute speaking mod about like solutions in general.
UK.
8-minute, 7-minute, 1 minute mod about educating medical professionals and spreading awareness to the general public.
So from most to least disruptive, we will be voting on Austria's 8-1 on combating resistant bacteria. Please raise your hand. I'm going to lower all hands now. Please raise your hand if you're against. This is just a reminder that you all must vote on procedural items. So this does not pass. Next, we'll be moving on to Bolivia's motion for an 8-1 on general solutions. Please raise your hand. I'm going to lower all hands now. Please raise your hand if you're against. Okay, so this motion clearly passes. Bolivia, would you like to speak first or last?
Last, please.
Please raise your hand if you would like to speak. And we would highly smile upon those who have only spoken once. South Africa. Russia. USA. Germany. France. Brazil. Chile. And then we will be doing Bolivia. So South Africa, whenever you're ready.
The delegation of South Africa has worked with many other countries, including the UK, France, Ethiopia, and many more, to come up with a 3-part plan on how to solve AMRs. So our first part is emphasizing research in underdeveloped countries to make sure that everyone knows what they are doing, to ensure that people are not spreading wrong antibiotics to people who actually need them. The next part is recognizing the importance of providing education in underdeveloped nations. This is very important because people need this education to know whether or not they're giving out the right prescriptions and whether or not they should be getting the medication. The last part is encouraging further development of possible actions that will restrict the amount of antibiotics being passed around. Thank you.
Thank you, Delegate. Russia.
Sorry, I was unmuted. Going off of what South Africa just mentioned, we are working together with a bunch of countries to create the most comprehensive solution possible. So first of all, as South Africa just mentioned, we are focusing on the importance of medical professionals. We are also understanding that there are many other issues at stake. One of the most important ones is ensuring that the public has a general idea of what AMR is and how it can be prevented. So we are focusing a lot on providing resources such as social media access and television ads to protect against AMR by providing resources for the public, general public awareness. And we also are hoping to allow us to work together with other nations and other NGOs to better, thank you.
Thank you, Delegate. The USA.
The delegation of the United States of America would like to commend the previous speakers for their thoughtful responses. So, as part of the comprehensive solution, we wish to provide the most inclusive as well solution for all nations, especially those that are developing and those who are hit the worst by AMR, which is an imminent global crisis. So first, we'd like to emphasize the public-private cooperation, which the U.S. is mainly focusing on. Major food corporations often have a large presence in underdeveloped nations, and they can utilize their brand names to first either fund education in these developing nations or simply spreading awareness through the use of advertisements and in collaboration with healthcare related organizations. So as a result of this public and private collaboration, we will be able to essentially combine our pre-existing initiatives and reach out to these nations who essentially have the most needs. And thank you.
Thank you. Germany.
The delegation of Germany would like to commend Israel and the USA, or not Israel, would like to commend South Africa. We believe it is important to educate medical professionals to prevent overuse and overdistribution of these medicines and antibiotics. Also, funds from the World Health Organization can help NGOs with campaigns of education. also funding further research and preventing a stall in solutions and medical aid. Thank you.
France?
Esteemed delegates and chair, in order to reduce the antimicrobial resistance, we should focus on ensuring that antibiotics are used appropriately by practitioners. This comes down to education about the adverse effects of antibiotics, funding, and research in developed nations. Thank you.
Brazil?
The delegation of Brazil would like to commend the previous speakers for their responses. We propose funding for furthering scientific studies of antibiotics that may be harder to resist by bacterial infections. Additionally, we agree with Russia and France that general public awareness is crucial in helping people prevent AMR in themselves and their communities, and believe that reaching out, especially to the most undeveloped nations, will have a significant impact on decreasing antimicrobial resistance.
Thank you. Chile?
The delegation of Chile firmly believes with Austria, Israel, and Colombia's stance on this topic. Their resolution provides a great way to solve the issue, which targets bringing awareness to the public, tracking antimicrobial resistance, and also creating antibiotics and using bacteriophages. Currently, 700,000 people die each year of antibiotic-resistant bacteria, and it turns out that 230,000 of this number is from tuberculosis. And it also happens that tuberculosis actually can be cured by bacteriophages, so we are looking at the potential to save 230,000 lives a year through bacteriophages and Israel, Austria, and Colombia's resolution. Furthermore, by building awareness, you can make foundations which will be able to fund the resolution along with using IMF and WHO funds. Therefore, I support their resolution.
And last, Bolivia.
Bolivia is in agreement with Brazil, Colombia, and Slovenia that the plan to fight against AMR is threefold and would like to summarize the plan. As Bolivia has said before, scientific research is necessary to understand the plight arising from AMR. Colombia stated that surveillance of AMR threats is a vital step in fighting this battle. And Brazil also feels that it is important to educate doctors, pharmaceutical companies, as well as citizens. Slovenia also especially believes in a hand-washing campaign. The delegation of Bolivia is also willing to listen to Austria about macrophages with further discussion. Hence, the funding should be targeted towards three things: scientific studies, surveillance, and education. This plan will ensure that the risk of AMR will drastically reduce. Based on what the delegates have spoken, most of the countries are in agreement, meaning that for most people, this will be a viable solution. Clearly, the outlined plan will ensure that the maximum number of people will be benefited, which is the purpose of WHO. The course of action
Thank you, Delegate.
Thank you.
So there are 20 more minutes before lunch, so the chair would smile upon 2 more moderated caucuses. So please raise your hand. Russia? Russia? Russia, you're muted.
Sorry, I didn't say anything.
Do you have a motion?
No, sorry.
Okay. UK?
7 minute, 1 minute moderated caucus about educating medical professionals and spreading awareness.
Okay. USA, Austria.
8 minute, 1 minute. Yeah, okay. On when hand washing doesn't work against bacteria.
Are there any more motions? Israel?
Would Austria be willing to amend his motion to 10 minutes?
Yeah, okay.
Okay, so now we will vote on Austria's motion 10-1 on how hand washing is ineffective against bacteria. Please raise your hand. Okay, I'm going to lower all hands. Please raise your hand if you're against this motion. This motion clearly does not pass. Next, we will vote on UK's motion 7-1 on educating medical professionals and spreading awareness. Please raise your hand. I'm going to lower all hands. Please raise your hand if you're against. This clearly passes. Just another reminder that all of you guys need to vote on procedural items. So this motion is in order. UK, would you like to speak first or last?
Speak first.
Please raise your hand if you want to speak. We would highly smile upon those who haven't spoken much. You guys will get priority. Ethiopia. Germany. Please lower your hand if you've been called. The chair would highly smile upon those who have not spoken much this committee session. Dprk. USA. Nigeria. Israel. UK, whenever you're ready.
Okay. Honorable Chair and esteemed delegates, the delegation of UK believes that spreading awareness is a vital part of reducing antibiotic resistance, as well as educating medical professionals. The UK believes that all leaders, especially those that are also magnificent shining stars, should require medical providers to inform patients about the adverse effects of antibiotics when they prescribe, as well as support campaigns to spread awareness across the world, especially those of underdeveloped nations. The UK also firmly believes that doctors and medical workers should be held responsible when they overprescribe antibiotics, and this will be ensured to not happen by educating and training medical professionals about inappropriate antibiotic usage and prescriptions.
Thank you, Delegate. Ethiopia.
The nation of Ethiopia has really stressed the importance of the education of health workers even from the beginning of this conference. We believe that since we're an underdeveloped nation, that we have the most trouble making sure that our healthcare workers are educated on items such as antibacterial resistance, microbial, sorry. We want funding mainly for education as well because it's such a big thing. And we want to make sure that funding is pushed towards making sure that our healthcare workers know what they're doing, especially since a lot of our healthcare workers have been going on the record saying that they don't know what they're doing when it comes to these items.
Thank you. Germany.
Germany would like to commend the UK in their speech. Underdeveloped countries have had a series of medical professionals being bribed by major drug companies. This has caused this major problem. Awareness and proper procedures can help lower the usage of antibiotics within these countries, and by educating the doctors that give out these prescriptions, it can help lower usage of antibiotics, preventing a spread in preventing greater usage of antibiotics. Thank you.
Dprk.
The DPRK would like to stress the importance of incorporating AMR awareness into public education. Spreading awareness does not have to be expensive, and by incorporating AMR into public education, we can target a large population and instill this awareness from a young age. Such wisdom, of course, comes from our glorious general who descended from heaven.
Thank you, Delegate. USA. USA.
Yeah. The delegation of the United States of America would like to commend the previous speakers for talking about one, education, regardless of whether or not a supreme leader recommended it. And we will actually agree with the DPRK as long as they agree to the nuclear deal with us. However, let's talk about AMR. AMR is not a new thing, and there are two main reasons why it happens. First is medical professionals in developing nations who do not know WHO guidelines. Many WHO guidelines do not recommend the use of certain medications, yet medical professionals in many developing countries still recommend these medications to patients, which increases AMR. Second, awareness and education, which the DPRK and many other delegations, including the UK and Ethiopia and Germany, stated. Self-medication is also a severe issue in developing nations, and in order to provide this, in order to reduce AMR significantly and solve this issue that has been pertinent for decades, we must incorporate a certain amount of education regarding and awareness regarding AMRs inside our public education. Thank you.
Thank you, Delegate. Nigeria.
Honorable delegates and esteemed chairs, the Federal Republic of Nigeria believes that antimicrobial resistance is a huge threat to the livelihoods of all citizens around the world, especially in underdeveloped countries, and would like to commend Ethiopia for their similar stance. For example, in Nigeria, all drugs for common diseases such like urinary tract infections have been affected by AMRs, so none of the drugs can actually treat the diseases affected by AMRs. This is shown by E. coli, cholera, and salmonella being highly untreatable against the first line of drug defenses. So by spreading awareness that these diseases have been affected by AMRs, we can conclude that spreading awareness will let other countries know that underdeveloped countries need help.
Thank you, Delegate. Israel.
Educating medical professionals may be important, but educating people is also important. Our bloc, along with Austria as well as Colombia, are thinking about not just educating doctors to educate people, but to have an education system that will educate everyone, not just doctors. And surveillance systems such as the IQAC will be used to make sure that pharmaceutical companies don't give too much antibiotics to doctors. And the DPRK came up with restricted distribution. And that's a really cool tactic that we can use for our resolutions. And thank you.
Thank you, Delegate. So there is 10 minutes left before we will adjourn for lunch. So are there any motions on the table? The chair would smile upon a moderated caucus. UK.
A motion to make the chair smile for 10 minutes, 1 minute speaking time on antibiotic usage in animals, food animals.
Can you repeat the topic?
Antibiotic use in food animals.
USA.
Would the UK like to amend their unmod to 8 minutes?
Yeah, sure.
Okay, with that, we will vote on this motion. All of those for, please raise your hand. I'm going to lower all hands. All those against. Okay, so this clearly passes. This clearly passes. UK, would you like to speak first or last?
Oh wait, sorry, I got disconnected for a second. Can you repeat that?
Would you like to go first or last?
Last.
Okay. If you would like to speak, please raise your hand. France, Chile, Austria, Costa Rica, Nigeria, and we will be taking one more, South Africa. France, whenever you're ready.
Wait, point of order?
Yes.
There are only 7 speakers.
Oh my God. Thank you, Delegate. We will take. Is there anyone who hasn't spoken yet who would like to speak or who hasn't spoken very much? Okay, Russia. France, whenever you're ready.
Antibiotics used in agriculture increase the rate of antimicrobial resistance and can spread to humans. We should decrease the use of antibiotics in agriculture, which will be done through improving farming practices, such as increasing hygiene in farms by creating mandatory health checks on livestock. Thank you.
Chile, whenever you're ready.
The delegation of Chile has had some troubles with antimicrobial resistance in its aquaculture industry. It has been found that in Chile, nearby Chile's near Chile's aquaculture farms, there have been residues of antimicrobials about more than a kilometer away from these sites. Chile has a clear problem, and Chile requires other countries to help out with and fund Chile to help isolate these aquaculture environments from the ocean or natural areas like lakes. Furthermore, agricultural use in antibiotics on land animals is also a very big problem, and Chile would like to make sure that people limit the usage of antibiotics in farm animals by giving them an economic incentive to do so by making perhaps meat with no antibiotics be worth more.
Austria.
Antibiotic usage in animals is a huge problem in the fight against AMRs. In fact, 80% of all antibiotics used are used on agriculture needs. And this is a big problem because a lot of the time, farmers don't even need to give the animal antibiotics. It's usually they just put it just in case. And so what I think we can do is using our surveillance systems to give antibiotics to an animal, they have to be checked out by a vet or to make sure that they really need an antibiotic like this. And this is very urgent because back in 2015 or 2016, there was a bacteria that was resistant to colistin, and that is really bad because colistin is our last resort drug antibiotic. And why it happened was because of overuse of the drug in Chinese pig farms. So if we don't want another one of this, if we don't want a repeat of this, we need to make sure that we're regulating usage on animals.
Costa Rica.
I completely agree with the last 2 delegates of how we have to limit our use of antimicrobial substances on animals. We use these substances to prevent animals and livestock from getting sick and let them grow faster. And these antimicrobial substances are in turn transferred by feces into the fertilizers of plants, making plants also containing antimicrobial substances, and this in turn makes our food contaminated. So I propose that we should only inject half of the livestock we use, and use the other half to produce fecal matter and fertilizers for our plants. So this would reduce the substances in our food by 2/3. Thank you.
Nigeria.
The Federal Republic of Nigeria agrees with Costa Rica that antibiotics used in animals will end up in waste that runs off into fields, which also ends up into food anyways. So regardless of whether people consume meat or plant matter, they will also be ingesting the antibiotics. And this is an important issue because in Nigeria, there is easy access to antibiotics by farmers, and there's no laws discouraging people to use antibiotics. And in a study with sample farms, people found as many as traces of 10 mixed drugs, where at least 3 of them are ineffective, which leads to antibiotic and antimicrobial resistance. Thank you.
Thank you. South Africa.
All right. As the delegation of South Africa has stated, South Africa is a very underdeveloped and in a current tribal and community state, state right now. Everybody works together, and mostly in farming and agriculture, like animals and livestock. This type of work. They usually focus on this type of stuff, and by giving them antibiotics, this will only harm them and not help them at all. So I believe that although we do not need a surveillance system, we could have checkups, like only if the animal is in desperate need of antibiotics do we give it to them, and otherwise they just have to combat it themselves. Thank you.
Thank you. Russia.
My good friends, let me tell you something. In 1892, Leo Tolstoy wrote an essay, Changed the World Forever, titled The Next Step. It focused on what it was like in the slaughterhouse, in its walls, around everything, the horrors of the meat industry. Now, let me tell you something. Russia has for long understood the importance of grains and vegetables and everything other than meat. Now, I think it's pertinent that all these other countries, all these other member states understand this as well and recognize that veganism is the only solution. We must get rid of all meat in diet and focus entirely on tofu and grains. Thank you very much.
Delegate. Lastly, we'll have UK whenever you're ready.
Okay.
That was absolutely beautiful question.
The UK would like to commend the first 7 speakers for their amazing points. The UK believes that food animals are a major part of antibiotic resistance. In the UK alone, 40% of all antibiotics are used on farm animals, such as chickens, pigs, and cows. And a study by the World Health Organization shows that restrictions placed on antibiotic usage in animals lowered antibiotic resistance in humans as well as animals. And although antibiotics are important to promote health and preventing mass illness in livestock, it's also used to increase growth efficiency and feeding efficiency in livestock, which the UK believes is inappropriate. And the UK believes that restrictions should be placed preventing the use of antibiotics for growth purposes. And the UK believes that there should be incentives for non-antibiotic animals. For example, we can produce an FDA-approved sticker on meat that represents non-antibiotic meat, which would attract more customers. Thank you.
Thank you, Delegate. So it is 12:30 and lunch is about to start. So are there any motions on the table? Chile?
Motion to suspend debate.
All those for? By chair's discretion, this passes. We will now be going to our lunch break. So you can, oh yeah, go ahead.
So how this is going to work is basically we're going to send all of you into the waiting room, and then we'll let you all back in at 1. Okay? Cool.